ZuriMED's first product is what we have named the BTB Conversion Kit. BTB stands for bone, tendon, bone. This kit makes it possible to add synthetic bone blocks to the most commonly used grafts for ACL reconstruction. What you see here is the surgical technique for adding these bone blocks in a short additional step that can be performed at the side of the operating table. Here the engineered bone blocks are stitched into a standard hamstring autograft. A hamstring autograft is the most commonly used graft for knee ligament reconstruction. We will see that just by this small additional step, the ability of the graft to heal has been drastically improved. To enable the reconstruction, the surgeon drills what are called bone tunnels into the bones that make up the knee. You see here the femoral tunnel being made using a standard tool called a retro drill that creates a small recess into which the graft with the bone blocks can be pulled. A matching tunnel is made on the tibial side. The graft is then anchored using standard fixation elements called endo buttons, with one button on each side, allowing the graft with the synthetic bone blocks to be secured tightly into the tunnels. The value of adding tricalcium phosphate bone blocks is that these should substantially speed the healing of the bone tunnels. In preclinical studies, we have seen that the use of these synthetic bone blocks results in substantially stronger reconstruction. We expect that this device will accelerate a patient's return to normal daily life after a surgery. We are planning clinical trials to confirm our belief that our device and our company could revolutionize the reconstruction of torn ligaments in the clinic.